Hello, I'm Ian Flinn from the Sarah Cannon Research Institute in Nashville, Tennessee. I'm joined today by Loretta Nastoupil from the MD Anderson Cancer Center and Amitkumar Mehta from the University of Alabama at Birmingham. We're going to talk about some of the exciting news that's come out of ASH 2021. It was a big year for lymphoma studies this year, and I think we'll have a great discussion. So, maybe we could first talk about the POLARIX trial. This is this large international randomized phase 3 trial trying to use the polatuzumab vedotin with R-CHP regimen compared to R-CHOP. It was some exciting results. I think for the first time we're seeing some in the frontline treatment of large cell lymphoma. We're seeing a trial that has a positive outcome. Can you walk us through that trial and give us a few comments on it?
Sure. As you said, that there was a lot of excitement about the Polaric Study. So Polaric Study is a phase 3 double-blind randomized study where R-CHOP was compared with R-CHP polatuzumab. And it was a large international study where patients with newly diagnosed diffuse large B-cell lymphoma with high-risk IPI were randomized between these two arms. Importantly, to mention that in both the arms, the patient received extra 2 doses of rituximab. The primary endpoint of the study was the investigator-assessed progression-free survival. And if you look at the data, the study did meet the primary endpoint. The investigator-assessed progression-free survival was better in the experimental arm, which is R-CHP pola arm, compared to R-CHOP arm. So yes, you can say that after a long time, we have seen that the needle is moved in the right direction. So positive study for frontline diffuse large B-cell lymphoma setting. Also, of course, the follow-up was shorter, but overall survival, there is no difference between those two arms. Importantly, the toxicity profile was similar in both the experimental arm as well as the R-CHOP arm.
Loretta, I think it was about a 6.5% difference, if I remember correctly, in progression-free survival between these two arms. And there's not an overall survival advantage. But what is your take? Is this going to be the new standard? This is what we're going to be doing in 2022?
Yeah, I think the takeaways from this study for me is we finally have a positive study, and that's after many, many years of trying. So what was different about this trial versus all the other attempts? I think what they did right is they made it easy for folks to qualify for this study. Meaning all we had to determine was IPI, and having an IPI of 2 or higher, and obviously meeting all the other eligibility criteria. That's so much simpler than trying to define the molecular subtypes. So that may be more attractive from a scientific and a molecularly targeting study. I think this is a really simple study. We replace vincristine, which is the least effective, in my opinion, of the CHOP backbone with a targeted therapy, and it results in improvement. Now, to be critical, the safety profile wasn't better. And yes, it was a modest improvement in PFS and EFS with no overall survival advantage. But when I'm in clinic and this is approved, if I have a young fit patient with an IPI of 3 or higher, it's going to be hard for me to forego this option, knowing how hard it was to finally get to a positive study.
I guess I have a very similar take to you. We know we don't have as yet an overall survival advantage, but at 6.5 difference in progression-free survival, if you're to an individual person, that's a big deal. And so I guess we'll look more from to get this drug approved, hopefully in this coming year.